Hello everyone, I'm Dr. Pooja and today we are going to discuss a very nice question again. It's an image based question, came in INI-CET 2024. So what is the image? One capsule is shown and they have asked about which hormone are produced from these zones. So first of all, by the options we can get to know that yes, this is the adrenal gland that they are asking about, right? It is the suprarenal gland because it is on the top of the kidney, and that's why we call it as suprarenal gland. And as soon as we see the word capsule, that means near the capsule we are going to have the cortex of the suprarenal gland, and towards the innermost side we are going to have this medulla, isn't it? So if I draw the diagram of the suprarenal gland, let's say that this is triangular, right? And it is going to have two parts. Always the peripheral most part near the capsule, which is known as cortex, and the inner part is going to be called as, of course, the medulla. Medulla is going to release catecholamines, right? So this is for sure that it is going to release catecholamines such as epinephrine, right? So two options are already out. D cannot be the androgen or cortisol, so it is going to be epinephrine in our case. It can be norepinephrine also, but that is not in the option, right? Let's talk about the cortex and its different three parts. So what are the parts of the cortex? There are three different parts. What are the three different parts and how we are going to remember? We are going to remember that via GFR. Now what is GFR? The outermost part. All these parts are called as zona. What they are called as? They are called as zona. Alright, so cortex is going to have three parts. Each of them will be called as zones or zona. So zona, this outermost will be zona glomerulosa, zona fasciculata, and the innermost is going to be zona, the innermost part of the cortex, not the medulla, right? It is going to be called as reticularis. So I'm not writing zona everywhere, right? So it will be repetitive. So zona glomerulosa, fasciculata, and reticularis, right? So GFR, you can remember the GFR mnemonic is going to be handy, right? So glomerulosa, please remember G never goes with G. That means it is not going to release the glucocorticoid. Then what it is going to release? It is going to release mineralocorticoid, isn't it? Mineralocorticoid, and which is the most common mineralocorticoid? It is none other than the aldosterone. Aldosterone, right? What about fasciculata? Of course, it is going to release the glucocorticoid. And what are the glucocorticoids? Cortisone, corticosterone. In our MCQ, it is going to be cortisol, right? Why? Because the option is given cortisol, right? It can be corticosterone also, cortisone also, right? Reticularis, when we talk about reticularis, is actually going to release androgen, or we can say the precursor of androgen, that is dihydroepiandrosterone, which is a form, or it is going to form the androgens finally. Androgens, right? So DHEA, that is dihydroepiandrosterone. So if we look at this, what we are going to say that A layer is G, this is F, and this is R, right? GFR. So of course, the G is going to release the mineralocorticoid, that is aldosterone. B is going to be releasing the glucocorticoids, that is going to be cortisol. C is going to release the androgens, and D epinephrine. So answer over here becomes option B. I hope you like the discussion. See you soon. All the very best.